Good evening, viewers, and good evening, doctors. Welcome today on ninth day of managing post-COVID patients with Dr. KK Agarwal, sponsored by PIFLU and Vitcofol capsules. So today I was interacting with my uh, medical representatives who've been meeting you personally when in your clinic, and I was taking the feedback of the sessions which we are going on this channel. Thank you very much to all of you, those who have appreciated very well. And I must tell you that the same thing we also felt like that. Many places where the COVID numbers have gone down and the patients are reporting to you with post COVID complications. And that was the thought we were looking for, a master in internal medicine and a doctor who is not only first hand experience of managing COVID, at the same time, he's also kind of gathered the world information on ongoing updates of managing the COVID and post COVID patients. So, therefore, we have chosen our teacher, master of post COVID management, Dr. KK Agarwal. And before I hand over the sessions to Dr. KK Agarwal for today's post COVID muscle, which is again, most of your patients must be coming and uh, uh, reporting you lethargy, fatigue, muscle pain. Obviously, he's going to take to us on that route. So, Vitcofol capsule winner of 3rd December is Dr. A.S. Khanna, is from Lucknow, and Dr. Varun Bhave from Pune city. Thank you, Dr. Khanna and Dr. Bhave. Now, I request Padam Shri Dr. K.K. Agrawal to take the session of today's session.
Thank you, Alang, and thank you, FDC, for coming out with an idea of training over 30,000 doctors across the country on post-COVID treatment. Somebody may ask, why are we talking about second last and why did we choose 10 sessions in post-COVID? Why not 5? Why not 12? Remember, on 10th day, your COVID becomes negative, the virus is attenuated, the virus is non-replicable. Today, on 10th day, without testing, whether you have a history of close contact or whether you are COVID positive, you can come out of isolation. So therefore, this 9th day becomes very important because we are talking about that your virus is dead, your virus is attenuated, and now you are entering into a post-COVID phase, which will last for 90 days. After 90 days, you are non-COVID. But if your post-COVID symptoms last more than 3 months, we call them as long COVID. Today's subject is the most difficult because we only have postulations. Nobody knows. I have spoken to US, Sweden, every medical association I have spoken, every country I have spoken. Do we have something to take care of the fatigue? As on today, the answer is no. So everything which is no is an opportunity for all of us. And fatigue is the bread and butter of all the practitioners in the country, because these people will keep on coming to you for the next 3 months. All my doctor intensivist colleagues in Mumbai, they say, oh my God, the amount of fatigue we had is intolerable. Today, we are going to go deep into it and to try to find out a protocol for post-COVID management. Before that, I want to quote Sankhya philosophy, a Vedic philosophy, which says that blood is converted into plasma, plasma is converted into blood, and blood is converted into muscles. They say food from ras to rakt to muscle, mamasa, is a sequence. Therefore, all disorders which have involvement of plasma and blood invariably will also have involvement of muscle, and they will have muscle fatigue. Let's have the slides, please. Can I have the next slide, please? So post-viral syndrome, because now when you say post-viral syndrome is synonymous with post-viral fatigue. Now everybody would say that when I run, I get tired. That's normal. You says, Mom, I'm just coming back from a cricket. I'm tired. It's normal. You say, I'm coming out after cycling. Give me a drink, energy drink. That's normal. That's a normal fatigue. But we are not talking about that fatigue. So it is a post-viral fatigue, is a feeling of tiredness and weakness that persists following recovery from a viral infection. You say, I get up in the morning and I'm tired. Now, after getting up, you are not supposed to be tired. You are supposed to be energetic. So a weakness which persists without exertion, we are talking about. You say, all the time I'm feeling weak. These are the patients who may say that when they have a bout of exertion, their weakness lasts for a day and they do not feel like doing any exercise. Some people will say, I go to the bathroom and I'm exhausted. I'm exhausted. Obviously, we have ruled out in these cases postural hypotension. Every patient who has a weakness, the weakness may be on standing, and autonomic dysfunction is known to occur in COVID-19. So we have ruled out autonomic dysfunction by doing a autonomic function test where we ask the patient to do a Valsalva and we see after Valsalva their heart rate variability is normal. Then we say no autonomic dysfunction. And if there is no heart rate variability and patient has tachycardia, we know it's a autonomic dysfunction. Weakness with the autonomic dysfunction is a well-known phenomenon. Next. So fatigue can be acute, that's less than 1 month, prolonged, more than 1 month and less than 6 months, or chronic, more than 6 months. So therefore, a patient who has acute fatigue, that's very common in COVID, lasting for 4 weeks. 9th day, when the patient is out of isolation, he says, I'm feeling weak, lasting for 1 month. Or it can be prolonged, that is lasting less than 6 months. So as on today, COVID-19 fatigue is either acute or prolonged. Will this end up into a chronic fatigue syndrome? As on today, we don't know. That's a CFS is a very well-known entity, and that is also induced by a virus. So over a period of time, some people may end up into chronic fatigue syndrome. But as on today, most of the patients will say, my fatigue is lasting for 1 month. Some will say lasting for less than 6 months. What should we tell our patients? Don't worry, I'm giving you a treatment. Your fatigue will be better by 1 month and you will be completely all right by 3 months. That's the assurance we must give. And I will give you the protocol how to do a cognitive behavior therapy to the patients. Acute fatigue resolves after rest while treating the cause. So acute fatigue means less than 1 month, resolves after rest or treating the cause. Here it is COVID, while uncontrolled, prolonged and chronic fatigue are debilitating. And the patient will ultimately end up into a depression. So our job is, by hook or by crook, treat fatigue within the first 4 weeks. Next. This is a post-exertional fatigue. Patient will say the hallmark symptom is fatigue is not exertional. Normally, he will say that I am lying down and having fatigue, worsened by low upright posture, not relieved by rest. No medical cause can be found out. The person says we can't find out a cause. So this is a, and sudden onset following an acute illness followed by recurrent flu-like symptoms can be associated with fatigue. So the patient will say, I'm getting episodic fatigue lasting for over a day. Then I am all right. Then again, I get fatigue. Sometimes he says, I respond better to mefenamic acid. Some people say, I feel better to colchicine. Some people say, I will have to take a low dose steroids. But all these things we will talk next. This can be a post-exertional malaise, regular activity followed by worsening or discomfort, and a recovery taking 24 hours. Some patients may come back and say that when I went to the office today, and after that for 24 hours, I couldn't go to the office. Third day again I went. So they say alternate day office, alternate day fatigue. That's a very common post-COVID manifestation. Some people will have a new onset headache, but if this headache is coming, please also rule out iron deficiency. Remember, that's what our aim is in this series, because we are also concentrating on Vitcofol, which is iron deficiency, which contains iron, folic acid, B12, and B6. So new onset chronic headache can be a part of fatigue, but can also be iron deficiency. Patients may complain of muscle and joint pains. In India, we are not getting joint pains, but people may have muscle pains. Now, these muscle pains in India, I'll give you a tip. Most of the muscle pain will be in calf muscles, below the knee joint. Nobody knows why. Nobody knows why we have muscle pains below the knee and absence of joint pains amongst Indians. So classical patient will say, मेरे घुटनों के नीचे दर्द हो रहा है. Now, this muscle pain may be associated with disturbed sleep. Daytime, they will be sleeping, and nighttime insomnia. And there, sometimes we come back the role of melatonin in handling these cases. Now, this muscle pain may also be associated with cognitive dysfunction, which we will be talking in great detail tomorrow. In our last session, we will be talking a lot about cognitive dysfunctions like a brain fog. Some patients may have autonomic manifestations. I have already said about postural hypotension. And some people may end up into depression, anxiety and depression. Obviously, a person for 1 month, 15 days, if he's on bed, he needs counseling. And therefore, it becomes our duty to tell them a story that by 1 week you will be better by so much, by second week you will be better by so much, by third week you will be better by so much, and by fourth week patient is going to recover. So we have to counsel patients in such a way that they are looking for improvement. If you are going to tell them we have no treatment, he will go into depression. Next slide. Now, what can be the cause of fatigue? A, it can be dehydration. If it is dehydration, take a electrolyte solution and drink it. So how do I know I'm not having dehydration? If I'm passing urine every few hours, at least every 4 hours I'm passing urine, then I'm properly hydrated. So dehydration can cause post-fatigue symptoms. And there I need a drink which is calorie-free, which is sugar-free, and which gives me enough electrolytes. That's one. Second thing I would look for CRP. C-reactive protein. If I find the patient has a persistent high CRP, even if it is between 1 and 3 as a low-grade inflammation, these patients will have an abnormal interleukin-6, and they will have gamma interferon, and they will have abnormal Th1 and Th2 receptor responses. That means these people have low-grade inflammation. Their CPK, CPK-MB may be normal. So they will have a low-grade inflammation in the body, which is causing a chronic fatigue-like picture. In such cases, anti-inflammatory role will definitely come. You may give a small dose of mefenamic acid. You may like to give a small dose of steroid. You may give a small dose of colchicine till their CRP becomes less than 1. So if you have fatigue, CRP more than 1, you may need anti-inflammatory. But if your CRP is less than 1, yes, you do not need any anti-inflammatory drugs with that. Make sure the patient thrombogenic stimuli is also taken care of. Microemboli can also be responsible for microischemia. Therefore, make sure if you are giving anti-inflammatory, also give oral anticoagulants to them. Next. Other causes can be genetics, childhood trauma, adrenal cell dysfunction, that is, patients are on a long-term steroids, delayed circadian rhythm, so give them melatonin, and there can be a lower zinc levels, or there can be omega-3 to omega-6 disturbances with them. So I give them lots of dry fruits, soya, and vitamins. Next. Another thing which comes is a mitochondrial dysfunction. And there comes the role of L-carnitine. All our life, till today, we have been talking about chronic fatigue syndrome is synonymous with L-carnitine because it is working at the level of oxidative stress. And we are talking about mitochondrial dysfunction. And people say that we give L-carnitine in such cases. Next. Now, this is if your symptoms last for 6 months, then only you will call it as a chronic fatigue syndrome, where 50% of the time of the day you are fatigued and you have an associated cognitive impairment or orthostatic intolerance. But as on today, we are talking about prolonged or acute fatigue. Next. Next. Now come back to the role of iron in chronic fatigue syndrome. Yes, low iron, whether it is a functional iron deficiency, can also lead to mitochondrial dysfunction and ultimately end up with a fatigue. This we have discussed in great detail yesterday. Next. So what do I do? What do I do? Hydration with minerals. So instead of having a simple water, you hydrate yourself with minerals, which contains all types of minerals: calcium, magnesium, sodium, potassium. So you add hydration with minerals. You look for L-carnitine, should I give it? Give them enough iron so that they are not anemic. Give them vitamin C, vitamin D, and zinc, which are essential for COVID management. So therefore, in a post-COVID phase, make sure they are given good amount of vitamin C, which is 500 milligram twice a day. They are given high dose zinc, 50 to 100 milligram. Continue their vitamin D. Add to them B6, B12, folic acid. So B6, B12, and folic acid. And our quiz, which talks about Vitcofol, contains B6, B12, folic acid, and iron. And don't forget to give them high protein diet, because protein is absorbed from small intestine. So what will I do? A patient says 9 days are over. So I say you are fine. His CRP has become normal. And in that case, I say for the next 3 months, now you continue vitamins. So I would give them 2 tablets. one which contains iron, folic acid, B12 and B6. And I will identify one more brand which contains zinc, vitamin C, and vitamin D. So I will tell them take one in the morning and one in the evening. So you take one tablet of Vitcofol in the evening, and you can take one more tablet of either you can take Health OK, ZACC, whatever you want to say, you can take, which contains a combination. So patient will feel I'm given one tablet in the morning, one tablet in the evening. Instead of telling them, you say so many other medications with that. So one vitamin in the morning, one vitamin in the evening, hydration with minerals, and carnitine, L-carnitine, if the weakness is very, 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 very strong. Now, this L-carnitine will also help you if there is a subclinical myocarditis. Remember, this is a time everybody is going to have COVID. Everybody is going to have COVID sooner or later. At least one infection they are going to have lifetime. Make sure this is an opportunity for us to eradicate iron deficiency, to eradicate zinc deficiency, to eradicate vitamin D deficiency from India. Don't miss this opportunity. If your patient hasn't got built up his hemoglobin without any to the level of 12 in women and 14 in men, and if they have developed COVID, as soon as they cross day 9, make sure they continue vitamins till 3 months. Even if you go back to the Ayush guidelines, whatever they are giving also contains vitamin C, amla. Chyawanprash is nothing but hepatitis. They give you sprouts, is nothing but zinc. They says eat in the sunlight. They are talking about vitamin D. They talk about high protein diet. So whatever they are giving, they talk about good, that's iron. So whether you go to any system of medicine, your choice is at this moment, you need good supplements starting from day 10 to day 19. Oh, next slide. Can I have the question of the day? The question of the day, in iron deficiency, hepcidin is increased, decreased, normal, none of the above. Now, this question we have discussed in great detail yesterday. If you have attended that program, you should be able to answer it without any problem. Over to Anang Basu. आपकी आवाज अनम्यूट करना होगा.
So every opportunity brings how you look into, like COVID, when it has come, the way you have turned it, flipped it, in saying that now it's the time to make sure that the iron deficiency, the vitamin level deficiency, the D level, vitamin D level deficiency, and the zinc level deficiency can be moved up and it can be eradicated in India. It's a beautiful thought, because it will not only make Indians more healthy tomorrow post COVID era, and they will become more productive. So that's the thought. This is how brilliant minds think, and that's why, sir, you are having the Padam Shri, and we call you, Guru and the Master of Internal Medicine, sir. Thank you very much today, sir. And the way you have simplified the protocol, because globally it has been seen that post COVID weakness is long and people have no answers to it. But obviously, counseling and protocol, which you have just suggested to us, most of our viewing doctors will start practicing from tomorrow, and obviously, patient will feel better. So thank you very much. Thank you, Dr. K.K. Agarwal and Doctor who are listening to us. Tomorrow would be our last day. And obviously, I would request you that in great numbers, come and join us at 8:30 p.m. for the last post-COVID managing with Dr. K.K. Agarwal. Thank you very much.
Thank you.